Recording. So good morning, everybody, and welcome to the March 13th 911 Advisory Task Force meeting. Our chair, Tina Powell, had something come up unexpectedly and is unable to join us today. And our vice chair, Kathy, has competing meetings and did not want to jump in and out. So I'm going to be leading the meeting for today. You're stuck with me. And I would just ask that if you can please sign in. I'll put a link in the chat there. I will call the meeting to order at 10:02 and I will call the roll. So do we have Scott James, Julie Nelson, or Allison Theunison representing CCI? All right. Do we have Jeremy Shepback representing CML? All right. How about Cheryl Garcia representing the disability community? Way to start off strong. How about Michael Berry or Trina Doomer representing at large? Tressa Carter or Tim Kunkelman representing BESP Lumen?
Tressa's here.
Good morning, Tressa.
Good morning.
All right. Sean Ward representing Entrado.
Ryan Sagersi is here for Sean Ward.
Thank you, Ryan. Do we have Jeff Winkleman representing ILEC?
Present.
Good morning.
Morning.
Do we have Jenny Santana representing Wireless T-Mobile? Ryan Hoke representing Viero.
Mary Graham's here.
Thank you, Mary. Good morning.
Good morning.
How about Cindy Hartkop, Tina Medevere, or Josh Hemingway representing CLEC VoIP Cinch? Jay Slater or Erica Stevens representing CLEC VoIP Bandwidth?
Jay Slater's here.
Good morning.
Good morning.
Jody Chin representing 911.
Good morning, I'm here.
Good morning. Travis Freeman representing 911. Cindy Castile representing 911. Kimberly Culp representing 911.
Hey, this is Kimberly. I'm on.
Good morning. Jackie Reynolds representing 911.
This is Jackie, I'm here.
Good morning. Beth Dobransky representing 911.
Good morning, I'm here.
Good morning. Alicia Libran representing 911. Good morning. Jeff Irvin representing 911.
Jeff's here.
Good morning. Renee Henshaw or Matt Toll representing 911.
Renee's here.
Good morning. Deanie Shin or Shannon Bren representing 911.
Deanie Shin, I'm here.
Good morning, Deanie. Andrew Dameron representing 911.
Good morning, Andrew's here.
Good morning. Kyle Mickelson or Kevin Biegert representing 911.
Kyle is here. Good morning.
Good morning. Tina Bonetta or Scott Newman representing 911. Kathy Rayleigh representing 911.
I am here. Good morning.
Good morning. Matt Gage or Alex Wall representing 911.
Matt here. Good morning.
Good morning. Carl Stevens representing 911.
Here.
Good morning. Patty West or Christine Mason representing 911.
Patty is here.
Good morning. And I did see Jenny join during roll call. So welcome, Jenny.
Thank you, Jennifer.
Yep. Just finding you on the sheet here. Is there anyone on the roll call that came in late that I did not catch?
This is Ryan from Viero. I think Mary's already signed in for us, but yes.
Yep, I have you both. Thank you.
Thank you.
Anyone else?
Hi, Jen. This is Norman from the BHA. Usually it'd be Kelly Bowman attending, but I'll be here in place of her.
I'm sorry, in place of who? I didn't hear.
Kelly Bowman.
Oh, okay, great. Thank you. All right. And for those of you not on the roll call list, if you could please sign in here, I'll put that in one more time into the chat. And we do have a majority and a supermajority, so we are good on anything we need to vote, which brings us to the next thing, which is approval of minutes. So I did send out the minutes after the last meeting, and they were in the meeting folder here for today's meeting. So I will scroll through slowly and entertain a motion to approve.
This is Carl. I'll make a motion to approve.
This is Andrew. I'll second.
Thank you, Carl. Thank you, Andrew. Any further discussion? And is anyone opposed to approving the January 9th meeting minutes? All right, minutes are approved. Thank you very much. We do have a 30-minute presentation from Kate Leatherby from Aviv. She's going to talk about Aviv's integration with Rapid SOS. So Kate, I will turn it over to you and stop sharing so that you can share your screen.
Thank you. Looks like sharing is not turned on. I just requested to share.
Yep, and approved for you, so you should be good.
Okay, thank you so much. Okay, I will share my screen. Can everybody see my screen, or can you confirm, Jennifer?
I can see.
Okay, thank you so much. As Jennifer mentioned, my name is Kate Leatherby. I work with a company called Aviv Solutions. I'm based here in Colorado in Douglas County. I have a background as a paramedic. I worked here for a service in the state. So I have a lot of respect for all of the work that you all do as 911 telecommunicators. I know the importance of it firsthand. So I'm here to talk to you today specifically about an initiative that we have called the 4-Minute Community. And what that means is we are working to bridge the gap in EMS response and getting access to defibrillation to patients in a more timely fashion. And we do that through an integration with Rapid SOS, a platform that I know most of you on the call are familiar with. So I will talk about that during my presentation. So to give you a little background about Aviv, we were founded in 2017. We're a company of just over 100 people and growing. And we're relentlessly focused on improving out-of-hospital cardiac arrest survival rates. As you can see there, we have an AED. That is the tool that we use to bring defibrillation to people. And that is the only product that we manufacture. So we do have a team of salespeople that sell the AED. I work on our community programs team as the director of community programs. So a little bit about our device before I talk about the integration, because I think it's important. It's the smallest device on the market, weighs 2 pounds. As you saw in that picture there, it's a little bit bigger than a cell phone. I compare it to maybe a fat iPhone, if that gives you a little bit of context. It has a touch screen and it has connectivity. So when we start talking about the integration with Rapid SOS, that's really the biggest part, is the connectivity with Wi-Fi, cellular, and GPS. A few other things about the device: we do have child mode and it has universal pads. We have female anatomy on the device. When the people that created the device looked at the data, they were really trying to make a device that was data-driven and trying to overcome some of the challenges that we see in the cardiac arrest space with people using AEDs. So we know that women are less likely to receive resuscitation than men. So we do feature a picture of female anatomy, and it does say the voice instructions say remove the bra. We have quick data retrieval. So there's a QR code. Once you turn off the device, you're able to quickly retrieve the incident data, and paramedics, EMTs are able to take that incident data to the hospital without having to connect the device and download the incident data. So real-time data has a rechargeable battery. So that reduces the total cost of ownership. There's no, you don't have to buy a new battery every 3 to 4 years. We also can convert that same device to a trainer. So there's a training cartridge that converts that device directly to a trainer. We have a Spanish button that comes standard. And then one of the other cool features with our connectivity is once pads are applied and the device detects there's impedance, it can alert Rapid SOS, who will alert the 911 telecommunicators. So the problem that we are trying to solve is, as I mentioned, we are mission driven to address out-of-hospital cardiac arrest survival rates. So we know that it affects over 350,000 people a year in the United States, and survival rates are very low, below 10%. It's the #1 cause of death for people over the age of 40 years old. We also know that early defibrillation, early CPR increases that patient's chance of survival by over 50%. This is a slide from University of Alabama. They're part of the Resuscitation Outcomes Consortium. And what I really want to highlight here is AED use. So this is time elapsed starting in 2011. And though we've seen more AEDs placed in the public space, we actually haven't seen AED use increase accordingly. And so we hypothesize that that's for a few reasons. We believe that the chain of survival is really broken. AEDs really lack meaningful connectivity. And when AEDs are placed in the community, it's really hard to understand where they are. I use an example often that if I go into the McDonald's and there's an AED on the wall in the McDonald's and somebody collapses at the Chase Bank across the street in cardiac arrest and there's no AED there, I would not know as a bystander that there's a cardiac arrest across the street, even though there's a life-saving piece of equipment sitting in front of me, and we know that that patient's best chance of survival is early defibrillation and early CPR. There's just that lack of understanding of where the AEDs are versus where these arrests are happening. And so we also know that survival decreases by 10% for each minute that passes. So of time-sensitive emergencies, this is really, we have very few minutes to intervene and do something for that patient to increase their chance of survival. The other thing that we know is that 70 to 80% based on CARES data is 70 to 80% of cardiac arrests are happening in the residential setting. So public access programs, they address a small percentage of where arrests are actually occurring. And we know that people in the residential setting likely don't have access to defibrillation. And so as we look at this chain on the far end of the chain, that would be me, the responder. And I say this with all the love for paramedics in the world, but we are not that patient's best chance at survival. We can sustain that patient's life if they are a viable patient, but it's really that bystander that's able to do something and intervene, and the 911 telecommunicators. You are absolutely vital in the chain of survival for that patient. And so whenever we work with communities, we take a data-driven approach. And so we look at historic data for cardiac arrest for a 2-year period. And so we really want to understand where are the arrests happening, where are AEDs located that are part of your public access program, and what are response times. And so this is a bit of a busy map that you see there. But what I think is the most important thing is all of the color codings. Those are the red, yellow, and blue. Those are where cardiac arrests have happened in this community. This is a community in the Northeast. And then the red dots are arrests where an AED was not applied. And then you see that gray circle, that's where AEDs are located. So we see that there's a lot of AEDs located near where cardiac arrests are happening. And I'd like to say this community was the exception, but this is really what we're seeing across the country. There's AEDs located near people that are in cardiac arrest, and the AED is never being applied to that patient. So what we feel is that, the AEDs lack meaningful connectivity. If I go into a building and somebody collapses in front of me, I may not know where that AED is located and may not ever be able to retrieve it during that event just because of connectivity. So I don't know where that AED is located. So we think that it's very important for these AEDs to be able to draw attention to them so that they are used. So that's where the integration with Rapid SOS comes in. 911 telecommunicators are able, through their Rapid SOS platform, and I'll show you what that looks like here in a few minutes, able to dispatch our AEDs. And so what happens when you dispatch the AED, you see that graphic there on the left, a screen will pop up. The AED will start talking and say cardiac arrest nearby, take this AED, cardiac arrest nearby, take this AED. Once they hit that button on the touchscreen that says navigate to emergency, it shows them exactly where that patient is located. And so that's what we look at with the 4-Minute Community. So again, I work on community programs here at Avive, and we work with communities to take a holistic approach to out-of-hospital cardiac arrest survival. So we know that it starts with that layperson and early recognition of CPR or early recognition of cardiac arrest and starting CPR early. And everybody on this call, all the 911 telecommuters play a vital role in that. So being able to dispatch resources, and we believe that dispatching an AED is a vital resource. Instead of having that AED siloed, we're now bringing that AED into the chain of survival. We're able to not only dispatch the EMTs, paramedics, firefighters, but we're able to dispatch the AED as well. And so when we look at 4-Minute Community, we look to really bridge that gap, as I mentioned, between EMS response, or even if you have police or firefighter first responders that are arriving on scene before EMS. Again, this is really the most time-sensitive emergency that we deal with. We talk about in trauma, the golden hour and things like that, but we really have 4 minutes to intervene for this patient. So the 4-Minute Community not only looks at placing AEDs in the public access space, arming police vehicles with AEDs, but also we deploy AEDs in the residential setting so that I can, if on my street here, if my neighbor's experiencing a cardiac arrest, I live in Douglas County, I know where West Metro's station is, but I'm going to be able to respond to my neighbor's emergency and get there much faster with life-saving defibrillation than West Metro Fire. And so before I share the video of what it looks like, let me pull up the screen. Are you still seeing my screen? Are you seeing looks like a Rapid SOS portal?
We can see the Rapid SOS portal.
Okay, thank you. Okay, so this is just these are stagnant screenshots, but I'll take you through them. So, okay, so we have a call that comes in. The button up here where it says dispatch AED, sorry, it started to hide, where it says dispatch AED, you would hit that button, dispatch AED. You can either use current lat long or you can put the address in. And then at the bottom there, that button will turn blue and it says make AED request. What that will do then, you see it says contacting Avive. So our system will search for, it'll wake up all of the AEDs within a mile radius of that patient event. And then it will dispatch those AEDs. So you can see, I can see an AED here. This is the AED logo. I can see that one's accepted. I see an AED here, but that was alerted, but not accepted. I see this AED here. Again, alerted in that green, that means it's accepted. So I can see that there have been AEDs that have accepted. So somebody is with that AED, they've hit the accept button, and they are en route to that patient. So I see also some data pops up here. So as the AED gets closer, I can see that AED move. It's more like a breadcrumb trail instead of tracking in real time. So you're going to get kind of a breadcrumb instead of just seeing that AED move very fluidly. But now this data box here, I see the device has been activated and I can see current step. They're on step 1. It's powered on. The pads have been removed. They've been placed on the patient and there's been 1 shock delivered. So as telecommunicators, that not only gives you that information to relay to responding agencies that an AED is on the way, that the AED has arrived with the patient, it's in use. You can also let them know that it's in use and a shock has been delivered. I think it's also helpful if, the AED has been powered on, but the pads haven't been placed on the patient. That allows you to give them better instruction and ask, is there an issue with placing the pads on the patient? So it gives you more transparency into what's happening on that scene with that AED. After the device is turned off, you'll get a notification that the device usage has been concluded and the AED request has been resolved. So very simple how that works. And then I will just, I'll play this video here. I didn't mean to do that. And so this, I actually was told by Rapid SOS, this was filmed somewhere here in Colorado. So there might be someone on the call that recognizes this PSAP, but I'll go ahead and play and you can see how this works.
911, what is your emergency?
It's my wife. I've been shaking her, but she's not moving. I don't
Okay,
think
hold
she's
on.
breathing.
She's not awake
She's not responding.
and she's not breathing at all.
She's not breathing. What do I do?
My partner's dispatching an ambulance to you, and I'm going to work on getting an AED to your location.
Can you hear me? Can you hear me? God, she's not responding. Please hurry.
Okay, I'm going to help you out, and I'm going to give you some instructions for CPR, okay?
Please, just hurry.
Cardiac arrest nearby. Take this AED. Cardiac arrest nearby. Take this AED. Cardiac arrest nearby. Take this AED. Okay, I've located an AED. I have one nearby. It's on its way to you.
Thank you. Please hurry.
Okay, looks like the AED is getting close. Can you go to your front door and meet them?
Okay.
Powered on. Stand back.
Okay. Well, that concludes my presentation. And it ended a little bit shorter than 30 minutes, so you all can have some time back unless you have questions for me.
Thanks, Kate. Jeff is in the chat with a question. Several agencies in our service area use PulsePoint. Have you gathered data reference saves when PulsePoint is in use?
So we do work with communities that use PulsePoint. Our program is a little bit different than PulsePoint because it's the AED actually alerting. And when we work on the 4-minute community program, we recruit responders for that program. We call them cardiac arrest rapid engagement team members. So they might be people that are members of a CERT team. They might be off-duty firefighters, paramedic, police officers. So we don't have an application like PulsePoint that crowdsources people to respond to emergencies. These are people that were intentionally recruited. So we do work actually with communities that use PulsePoint as well. Our belief is the best AED is the AED that gets used. So whether that's our AED or PulsePoint is being used and somebody's using another AED, that's the point, and that's really the ecosystem of addressing out-of-hospital cardiac arrest.
And then do you provide training when you deploy those things, and what level of training do they get?
We do. So it's not you buy some AEDs. It's a program, and so we have an impact manager. She has a long history, I think 13 years with the Resuscitation Academy out of Seattle. She's also a 911 telecommunicator. That is her background. So she works on the implementation and does training for the telecommunicators, does training for the care team members, training for EMS. So if I were a paramedic and I arrived on scene and, a cardiac arrest is a chaotic scene. So the first thing I want to do is bring order to it. If I see some person there, I'm going to ask them to probably kindly step out of the way. So there needs to be a level of awareness amongst the responding agencies too, that there's care team members. So they usually have a vest on or something that brings attention to who they are and what their role is in that resuscitation. And so we usually try to integrate those care team members into training with public safety in whatever region that they're working with. So we try to integrate them into that system of response.
Thank you. And Joe has his hand up.
Yeah, I have two questions. One is there a link you can provide or a slide deck that we would be able to pass the information on to other people who may be interested? And the other is, to understand you don't sell these, how do you get team members? How do you get these out into the community? If a PSAP, for example, want to have one of these located in the PSAP, how would they accomplish that?
Yeah, so to answer your first question, yes, I can share information with Jennifer after I leave the call so that she can share it with the group. And then I'm sorry, Joseph, can you repeat the second part of the question?
Yeah, I thought I heard you say that people don't purchase these. You have team members, you provide training. How, if, for example, a PSAP or a business wants to have one of these located in their premises, how do they accomplish that?
Yeah, so any business or PSAP or anybody can buy one. We have a website. You can go on the website and buy an AED. But when we work on these, the 4-Minute Community Initiative, one example is in Cumberland County, Pennsylvania, and Dauphin County, their neighboring county in Pennsylvania. They're usually funded by foundations or grants. And so it's not usually a municipal budget that is funding these programs. The Peyton Walker Foundation, Peyton Walker was a young woman that experienced cardiac arrest while away at college, and her mother in her memory started the Peyton Walker Foundation. And so Julie Walker's foundation raises money and distributes AEDs into community, and also works on building these 4-minute communities in Pennsylvania. And so whenever we do a deployment, say, we do an assessment, the assessment that I mentioned, I showed you a quick screenshot. We also look at risk factors when we do those assessments. So where are the most cardiac arrests happening? We know that rates of poverty affect cardiac arrest. And so we look at, we risk score different areas of your community, and we recommend a deployment. And so whenever we come up with a number of AEDs that we recommend to be deployed in the residential setting and in the public access setting, that's part of that grant funded program. Does that make sense, Joseph?
Yeah.
This is Jeff. I've got a 3-part question, if I could.
Sure.
So I'm curious as to what the shelf life is on a charge. I assume they're lithium batteries, so it's probably quite lengthy. How many zaps can you get out of a charge? And once it's been deployed, do you have to then go through some process to reset it, or do you just put it back in service?
So the shelf life of the battery, our devices are warranted for 8 years, which is really FDA standard, but the battery will last probably 13 to 15 years. It's a lithium ion battery, as you mentioned, so they have a really long shelf life. The charge on the battery it depends. So if we have power modes on the device, if the device is in what we call high power mode, that would be when it's utilizing that integration with Rapid SOS. The device is constantly communicating with the server saying, is there a notification for me? Is there a notification for me? So that's going to drain the battery life. Whenever we work on the 4-Minute Community Program, we recommend that those devices are plugged in whenever they're not being used. But you'll get about 5 to 6 weeks of battery life out of those devices on the Connect screen, which is that touch screen. And then the AED battery, you'll get a little bit longer time because the two of them are separate. And then if it's not part of a community where it's being alerted, it'll last about a year. So 9 months to a year is what you'll get on that battery life. After it's used, we get about 70 shocks from one full charge. So plenty of defib available for a fully charged battery. And then there's no requirement to take it out of service. All that you need to do is you can plug it back in. It won't fully drain the battery for one resuscitation, but that device is ready to go once the pads are replaced.
Cool.
Thanks, Jeff. And then Holly had a question in the chat. Are only PSAPs able to dispatch the AED, or if an individual or a community like a workplace knew about a Vive, could they dispatch to their location?
So only PSAPs can dispatch. So they have to have access to the Rapid SOS platform. We don't have the ability for any business or local community to be able to dispatch the AEDs on their own.
Great. And then I have a follow-up question with that. If you happen to have one of these and you are part of the program and an incident occurs in your area, it looks to me like you could still use the AED without it being dispatched, pull it off the wall or wherever and pull out the pads and use it. Is that correct?
That's correct. Yes. So it doesn't have to, we don't have to dispatch it. It works just like an AED, any other AED as well.
Do you have any provisions for mobile installation, like in taxi cabs or buses or anything like that? Have you guys thought about that?
I mean, we do have our AEDs in communities that we work with, like especially 4-minute communities that are really working on building that ecosystem, like Department of Public Works or Parks and Rec, police often have AEDs installed in their vehicles. We could likely do the same thing on like public transportation as well.
So I'm not sure if your hand is still up from before or if you had another question.
I do. So if it's not one of your community grant things, but a business, somebody wants to buy one of these and they're in an area where the PSAPs use Rapid SOS, will it connect to Rapid SOS, or does that have to be part of your program?
So yes, they can connect to any AED can be alerted. It has to be again in high power mode. So that's a configuration setting on the device. So as long as that individual went in and put it in high power mode, that device could receive notification.
Thank you.
And then Holly's question in chat, can individuals purchase to keep at their home?
Yes, I actually, working for this company and knowing the statistics, I bought them for my parents, and they keep them at their home. And I actually, the other nice thing about connectivity is there's a fleet management aspect that you can log into the web and you can see the health of the devices. So my parents, I get a check-in every week that tells me the battery's charged, the pads are okay. And so I know that their devices are operational. I have a device myself, and when I hike, I'm a pretty avid hiker. I take it out on the trails here with me in Colorado. I take it to the grocery store. So it's very small and portable. And yes, you can purchase it for your home.
Awesome. And then Renee in the chat says, after the first free year, there is a $199 subscription fee. I'm assuming you must pay that and be connected to receive alerts from the PSAPs. Are you finding issues with people paying the subscription fees?
Yeah, so that is correct. Yes, there is a subscription fee to be able to maintain that connectivity to cellular and Wi-Fi. And so no, we actually have a really high renewal rate. People find value in it, even people that aren't part of the 4-Minute Community Program. Of course, it is a requirement if you're part of a 4-Minute Community Program or you have what we call PAD Plus, that's just devices in the public access space that you want to alert. You do have to maintain that connectivity. Individuals that purchase it, I always say, try it for the first year. If you don't find any utility in having the connectivity, then you just don't have to renew it. So I think it's probably more advantageous for those that are participating in a PAD Plus or 4-Minute Community Program. I like it for my parents because I have my parents, they have 3 devices, and so I can remotely monitor them. So I'll likely renew my subscription, but you don't have to have that subscription for the AED to work.
Awesome. Who else has questions? So what kind of is the 4-minute program? I assume that has training materials and guidance for PSAPs that want to know more or become part of that program.
Yeah, if there's any community that is interested, you can feel free to reach out to me, Jennifer, if you want to share my contact information with the group. I'm happy to, I'm here local in Colorado, so I'm happy to meet in person and share more information or even meet remotely because I know people have pretty busy schedules. So I'm happy to continue the conversation with anybody that's interested.
Thank you. And Joe, your hand's up.
2 questions. If somebody like your parents use their AED device, will that upon use notify the PSAP, or is it just
it will.
The PSAP notifies once that something goes on in the area?
It does work both ways. So as I mentioned, once the pads are placed on the patient's chest and the device detects impedance, it will alert Rapid SOS, who will alert the PSAP. So I don't want to mislead and let you think that it alerts you all directly. It'll alert Rapid SOS, and Rapid SOS will let you know, hey, there's an AED in use in your community, and these are the coordinates.
And is there a cost to the PSAP to implement this service?
So as part of the 4-Minute Community, there is a cost for the integration. Again, it's not, I've never seen a PSAP directly pay for the 4-Minute Community. It's usually a grant-funded project. That's a lot of the work that I do is I help these communities. I'm very active right now in that process, working with some communities here in Colorado and in Texas to raise funds specifically for the 4-Minute Community Program to cover those costs.
Can you tell us what the cost is?
So if you're doing a PAD Plus, what we call PAD Plus community, that's just you get access to the integration. There's training, but it's more, I'd say, low touch interaction from our team. That's $15,000 a year for that integration. And then for the 4-Minute Community, which comes with a whole bunch of service. So training, you have an impact manager that's assigned to you. continually reviewing the data. She does training for the care team and essentially runs that program. That's $50,000 a year.
Jeff, you've got your hand up. And I think you're on mute.
Let's try that again. So in Colorado, we have a Good Samaritan law that helps to insulate people who act responsibly from liability. Have you run into elsewhere in other states issues with people being reluctant to respond or be a first responder?
We have not, and we actually have, I think you bring up a good point. Good Samaritan will protect the responder. There's also, the groups that participate in this, if it's the Peyton Walker Foundation supplying all these AEDs out into the community, then you start to think about indemnification. And so we are the only AED on the market that will indemnify the company that purchases the AEDs if a trained or untrained responder utilizes our devices. A lot of indemnification policies specify that to indemnify the company, the responder or whoever uses that AED has to be trained on it, or they will not indemnify that company. We believe in our device so much, and when we tested it with the FDA, over 90% of people that had zero history with CPR or AED use were able to use our device on the first pass. So we will indemnify the company if an untrained responder utilizes our device.
That's great.
So I was looking to see if Karen or Sam were on the call so they could speak to whether there was a cost for current Rapid SOS users. I don't see them, but they might join. So for those of you who are interested, I think it's probably worth reaching out to Sam to ask if there's a cost to the PSAP or if that's already built into your Rapid SOS subscription or agreement. Since, and just for everyone's awareness, we only have a few PSAPs in Colorado that are not using Rapid SOS. The vast majority of our PSAPs are. So that's helpful probably for you to know, Kate.
Yeah. Thank you.
Yeah.
I do see Holly's question too. Will it only alert Rapid SOS with the subscription? So the quick rescue, that's what I talked about, where the device will alert Rapid SOS. That there's no cost for that. So you don't have to have you do have to have the subscription, so the ongoing subscription, but there's no additional cost for that. So as long as you have an active subscription, and you have the connectivity, because you have to have the connectivity for that to be able to contact Rapid SOS, but there's no additional cost. It's not an add-on cost in addition to that $199 a year.
And I think what Holly's asking is it's only alerting Rapid SOS and not anybody else, correct?
Correct. Yeah, it's not alerting anybody else other than Rapid SOS. And I don't believe, and you all can confirm, but I don't believe Rapid SOS, there's any extra charge from the Rapid SOS side. I think that our integration cost covers both sides.
Great. All right. Who else has questions? Obviously a lot of interest, Kate.
Wow. Yeah, this has been great. A great group.
Joe, go ahead.
So to follow up on Holly's question, if your parents use your AED, you don't get notified.
I do actually. So I have it set up because I'm managing their fleet on a browser, and so I can set it up as an admin for those devices. That as soon as the pads are pulled on that device, I'm going to get a text message on my phone that says one of those devices is in use.
But if say my kids bought one for me and they're not administrators for your company, they won't be able to get notified.
Oh, they would. Yes, absolutely. So whenever you buy an AED, you get what you call a Real Connect account. And so that's the web-based management of the fleet. They could get a username and password. They could set up a username and password with your account and set up notifications. So if your AED was used, they would be notified. You don't have to be an admin for Advive. You just have to be an admin for your Real Connect account. And that is your account. Yep.
So Karen from Rapid SOS did join. Karen, we've had a lot of questions and interested in Avive and just want questions specifically about costs to current Rapid SOS customers if they want to take advantage of this program. So not to put you on the spot, but if you have any information that you can share, I think people are interested.
I am happy to share that there is no cost to launching Avive AED within the Rapid SOS Unite solution. That is just one of the greatest values of the partnership that we have with Avive. Love the work that they do and really believe in the out-of-hospital patient care and improved outcomes for them out in the field. And the ability to launch that directly, from a 911 call right inside of a screen that you're already using. You can do that. We can get that enabled. It would just require for that area to have Avive within your community.
Awesome. Any other questions for Kate or Karen?
Kate, are you familiar with Dr. Stein-Bronsky? This is Renee Henshaw.
Hi, Renee. Yes, we actually just did the community assessment for El Paso and Teller County. And so I presented to Region 4 Task Force a few weeks ago, and I'm presenting to Teller County EMS Council next week that data.
Okay, because I know he's a big advocate of that, and it presented down here at the authority, and I've talked with him at length kind of about it. There's a few things in the way that he presented it that I'm understanding a little bit differently now with your presentation. Was there an additional app that goes on a community member's phone, or is it simply the alert through the AED itself, like shown in the video?
Yeah, so we did in the early days, we did have an app. I think that it didn't, apps can be buggy and people have, my phone might log me out depending on my settings. And so we did away with the app, but we do have, in conjunction with the AED alerting, you get text message based notification. So I can set up alert zones, like in my house, if I'm not physically with my AED, I'm outside working in the garden, but I have my phone with me, I can get a text message notification to my phone. Or if I set up an alert zone, at the park down the street, I can get a notification on my phone that there's an event down the street as well. So there's text-based notification in the AED alerts.
Okay, because I think some of the early concern on that app part was there was a cost associated with or possibly a cost going to be associated with that app. So it looks like that now is eliminated.
No, yeah. And Renee, yes, we are working with your community. If you can attend the Teller County EMS Council meeting next week, you'll see me present your community's specific data.
Thank you.
Yeah.
Awesome. And Karen with Rapid SOS just put in the chat that they're happy to set up time with Avive to demo how it looks. So it sounds like there's considerable interest, and that might be worth checking into, Karen and Kate.
Great.
Yeah. Well, Kate, if you will send me whatever you want me to share, your slide deck, your contact information, I'll make sure that gets put in today's meeting materials folder. And obviously this recording will be on our YouTube. So thanks very much for joining us.
Okay, thank you so much, Jennifer. And thank you everybody on the call for being so engaged and all of your wonderful questions. I appreciate it. Have a great day.
Thanks, you too, Kate.
Bye.
All right. Next on the agenda, I'm going to go down, I'm going to skip to new business item, which is ground ambulance talk groups. And I'm going to ask Joel Kingsbury Roth to present just so we don't have to hold Joel for the entire meeting. So Joel, do you have something to share visually, or are you just going to be speaking?
I can share the rule if you guys want to read it yourself, or I can just read it off myself. It's up to you.
I think you should be able to share your screen if you want to.
Okay, perfect. I lost my Zoom. Perfect. Well, thank you guys for having me. My name is Joel. I'm the ground ambulance licensing specialist with the Colorado Department of Health and Environment. Ground ambulance licensing came into play July 1st of 2026. And so in making the rules, one of the rules involves communication equipment in each ambulance. So I put the rule up here on the screen, and it is the basis of it is on or before July 1st, 2026. Each ambulance will need two different forms of communications. Each equipment on each permitted ambulance. There's a two-way voice communications with the PSAP, and that's where all of you come in. So we have been working currently with a SIMTAC safety subcommittee to figure out how to present getting connected with the PSAPs and what that looks like going forward. So one of my big reasons of showing up here today and talking to you guys is really introduce you to this and get your opinions on how this rule is written and what you guys can do to help us. Now, the way that I read the rule is really for interoperability. So we're talking about the big one, the mass shootings, the mass forest fires, these big disasters. We want every ambulance service to be able to be connected with each other. With being connected to the PSAP, that's where all of you come in. So we have been working with CCNC and we've been working with Jennifer on this safety subcommittee to really figure out the best way to connect all ambulances in the state of Colorado with a PSAP. Now, I don't believe that this is going to mean you guys are going to be dispatching a bunch more people. I think it's more of if the big one happens, those ambulances that aren't normally dispatched by the 911 system, so your interfacility, your private companies, your out-of-district companies, have some sort of access to the PSAP. We've been throwing around the ideas of working with the MAC channels, working with the RETAC channels, and figuring out the best way to provide guidance and assistance to our private agencies that may or may not be connected to a PSAP. So some of the questions the safety subcommittee wanted me to ask you guys is, are you aware of this new law, of this new rule that is coming into place? And this is very interactive, so if you want to just pop off mute and let me know, we can do a back and forth conversation that way.
So this is Jeff Irvin. I listened in, or I was on when this discussion took place on the CCNC meeting, and I guess the only pushback that I heard was with regard to privates being on the DTR. Is that your understanding?
Yeah, and that's what we're trying to look at. We did talk to CCNC, and we want to make sure that everybody is involved with this conversation. So we're more looking at, is this rule viable? Is this something that you guys are willing to accept? Because in the reality, we can't force people to be on your PSAPs. We can't force people to have a communication with you unless you guys are willing to allow them into your channels or allow them have access to your PSAP. Yeah, Chris.
Joel, this is Chris with Delta County. Just one point of clarification. I know your screen shows 2026, but I thought that these rules were already in place as of July 1, 2024, requiring the connection with dispatch centers.
Correct. So the rollout of this ground ambulance licensing rules, we knew that there were some rules that were not going to be able to be adhered to right away. So we had a 2-year delay on some of our requirements, and the communication, we knew it was going to be a struggle for some of the privates and some of the rural areas to access these. And so we gave a 2-year delay on meeting these requirements.
Okay, and the second part of that, I am one of them on CCNC as well, and I believe another point that was brought up was, well, some of these private companies and just interfacilities may not even have the necessary equipment in the ambulances to talk with dispatch centers on either DTR or VHF or one of the other systems. Has that been addressed in any of your other conversations?
Yeah, we've definitely looked at the hardware portion of how to guide agencies on getting the proper equipment. Again, we can't, as a state, tell them you have to buy Motorola's and you have to get them registered with Front Range Radio and things like that. We can't give them specifics, but the safety subcommittee is working on a guidance form for these private agencies to get onto those situations or get the equipment they need.
And would a workaround through their dispatch be, you know, a phone patch for their two-way that they're using, and then perhaps a cell phone for the second part of the leg for them?
So that's really what we're kind of exploring is we want to make sure it does say two-way radio communication. So whatever that looks like, whatever the safety subcommittee comes up with on that, and then the redundant form can be another type of equipment, which may include a cell phone.
And I wouldn't want to limit, you know, using the term two-way would limit full duplex phone patch or something they could do through their radio system. You know, they might be careful about the language there.
Okay. I appreciate all this feedback.
It looked like Renee had her hand up. Renee, did you still have something?
I was just gonna more make a comment because I'm sure there is a lot of challenges in more rural areas or whatnot, but you know, down in Colorado Springs here for gosh, over 15 years, we've actually had the private ambulance dispatchers working out of the city of Colorado Springs Dispatch Center for that really good interoperable, and the Colorado Springs Fire Department policy requires the private ambulance to actually come up on our Fire One dispatch channel and communicate with them directly to their response and arrival. So we've had direct communication with the private ambulance company for years and years, and it works pretty well. My initial concerns early on was, you know, the PSAPs having any responsibility for the ambulance communication, but it's very limited. And what they get on the air and communicate directly with fire responders about, but we have that all set up should we have those larger incidents, like in the case of our Club Q shooting.
Thank you. That's really good to hear. I know down in the Springs area, AMR works really well with Colorado Springs Fire. And then I know Asteri was on the radio network for a while as well. But we're looking at those private ambulance companies, and we do have numbers based on those. So out of the 211, oh, I gave myself a heart attack there. Out of the 211 agencies, currently we're only looking at about 18 agencies that really need the guidance on this, and a total of 127 ambulances that will need to be put onto the system. So one of the other questions the safety subcommittee had was, is there any private agencies currently working with your agencies in the state to adhere to this law? So has anybody reached out to you guys and said, hey, there's this new law coming out. How can we get access to the PSAPs? I take that as a no.
This is Jeff. I'm not in that loop, but Kevin Garcia would probably be the one that I'd look to at JeffCom, you know, to see if he's been approached. And you know, Kevin, I'm sure.
Yeah.
Kyle's got his hand up.
Yeah, just and I'm pulling some context to answer your question from my time as a street medic. I think really in the metro area particularly, the PSAPs here are not going to have had that engagement. because the private ambulances in the metro area already have arrangements to be on those systems that predated this rule. So, for example, when I worked at Pridemark, we already had access to the DTR so we could interface with the agencies that surrounded us. And there's been a long-standing tradition of privates interfacing with Denver paramedics on Green One, for example. So I think particularly in the metro area, you're not going to have seen that in relation to this rule because those arrangements are already in place. And we have that with Stadium because they operate in our jurisdiction. And we've had AMR and Apex have also come into our jurisdiction. They already had this functionality. So, speaking specifically to JeffCom now, we haven't had a need for this and no one has approached us specifically on this rule.
Okay, that's good to hear. And Pam Monty, I just say system as the radio system in a generalized sense. I'm not an expert in radios by any means. I am a previous EMT and I have been on some of the PSAP systems. I worked with Action Care prior to this, and they do a lot of mutual aid with South Metro, Arapahoe County areas, and Denver as well. And so I know we can bounce through those channels, and that's about the extent of my knowledge. I did dispatch for a short period of time, but I'm not really sure what I mean by the system, so I apologize for using that word. Chris, you had a comment?
Yeah, I was trying to think back. This was brought up at CCNC by the state who manages the digital trunk radio system, but that's only one system. I know there was conversation that some of the other systems in the Denver metro area, Denver, Weld, PPRCN down in Colorado Springs, and they were not as eager to let private ambulances onto their systems. And they felt that CDPHE was really overstepping authority of saying that we had to let ambulances onto those networks to talk to dispatch centers. So I don't know if you've reached out to all those other systems, Denver, Weld, etc. Because the state system, there's interoperability there, and Jennifer can probably explain it better, but there's more than just one system.
Yeah, and that's why I came here today, because like I said, I'm not an expert and you all are the experts. This rule was written prior to me coming in, and we're trying to figure out the best way to approach this rule. And so that's why I'm trying to gather all information I can to bring back to our safety subcommittee so we can come up with a good, hey, this is going to work. Hey, this is absolutely not going to work. Hey, this is going to work with these restrictions, whatever it is. So that's why I'm really excited to be talking to you all and really figuring out what the next step and what the best step is to take in this situation. Since it is already written in rule, how are we going to handle going forward? And if I could, if I could go back and change the rule, I would happily do that in more than one spot. Yeah, Jody, you have a comment.
So yeah, like Chris, I also sit on the CCNC Southwest board, and during that discussion, it was brought up that this was related only to private ambulances needing access for critical events, mutual aid type stuff. Is that correct? And I believe the discussion centered around with the state and with the other radio groups that the outliers, such people unlike Colorado Springs, who has a direct relationship with a private ambulance company under a contract, that those ambulances would be granted, and I don't know if it's finalized through CCNC yet, permission to use the MAC channels, which would be the very definition of what those channels were designed for, as opposed to agencies giving access to their main channels. And so I think that that's really kind of the key here, is that it's not necessarily that the private ambulance companies need on your main radio channels, right? They just need access to the PSAP, which could be accomplished through the MAC channels.
Yeah, and when we first started diving into this, We have a couple people on our team who have done radio communications in the past, and that's really what we as the department and the EMTS branch was looking at is, being able to access these channels, the MAC channels, or even the RETAC channels, depending on how deep we want to dive into it. But we also want to make sure that those channels are connected to a PSAP somewhere. So we wanted to get kind of an idea of, we don't want to tell you, hey, you have to monitor MAC 13. We want to be able to get to the point where I can go out, look at an ambulance, scan through their radios and say, okay, these match what we're looking for. And we're not even sure what we're looking for at this point in time. So those MAC channels are I think if I had it my way, that would be the route that I would go to, is making sure that MAC channels for interoperability is what we're looking for. I don't think any 911 dispatcher should be dispatching private ambulance companies for anything other than the private mutual aid agreements. That I disagree with that fully. So this would be interoperability mutual aid situations.
Right. And I understand, I think Pam's on, but yeah, I think the idea being that a private ambulance company would not be coming into your area unless you were requesting them for mutual aid. And at that point, you could assign them a channel that they could move to during this mass casualty or this major event, such as one of the MACs, which may be in use at that point to direct incoming. I mean, they wouldn't be any different than bringing in some other outside help, right? They would all kind of land on a MAC channel till you could assign them out. And I think that's the kind of the key that the ambulance licensing needs to understand is that the ambulance wouldn't just pick up the radio and say, I'm responding, specifically a private ambulance, right? They would have to be invited in by the jurisdiction, who would then manage what radios they communicate on.
Correct. And when I was dispatching for the private agency, the only way that I would have my crews get onto either a MAC channel or a green channel or a mutual aid channel is if I assign that to them. And the only way that I assigned it from them is getting a phone call from the PSAP saying, hey, do you have any ambulances available? That's how I have read the rule. We're still working on getting our policy team together to really interpret the rule. But all of these suggestions and comments have really, really pushed me into understanding kind of your aspects of it. And I can bring that back to the safety subcommittee as well and discuss that, and we can see what we have for a path going forward. Is there any other comments or concerns?
This is Jennifer. I would just reiterate, I asked Joel to be here because he approached us to try and figure out how best to get the word out. And I think that this conversation is extremely valuable. I wanted to make sure that PSAPs in the state were aware that this was a topic of discussion. And I want to stress that there's no one size fits all solution for these 127 ambulances. It might be access via VHF, UHF. It might be access via the state system on a specific channel that works specifically for that PSAP. I did provide Joel and his team with our contact list for PSAPs because the advocacy that I have been stating over and over is to work with the PSAP leaders directly on which channel would be best for them. The other application, yes, I think this is important for mass casualty, but I also think it's important to remember that we have a lot of rural areas in Colorado, and those ambulances traveling through those rural areas, if they come up on some emergency themselves and there isn't any cell service, it's a good idea for all involved for them to be able to reach somebody possibly via a radio system so that they can request assistance in those situations. So again, I just encourage you all to work with Joel's group from the PSAP level perspective to make sure that whatever gets put in place in your area works for your PSAP and isn't dictated by someone who doesn't quite understand PSAP operations. Joe.
If there are only 18 ambulance companies and 127 ambulances that aren't yet able to do this, would it help to identify them or what areas they operate in so that the PSAPs that they would need to interact with, we can focus on those ones who need to address and they know they need to address this problem?
Yeah, and that's one of the other struggles that I'm trying to present is, some of these companies do transfers from Pueblo to Fort Collins along the I-25 corridor. So being able to work with those teams to say, hey, if ambulance 3 is in Fort Collins, then ambulance 3 needs to have access to the northern area. But that radio can't leave that area because I don't want ambulance 3 going to do an extra call down in Pueblo and dragging that channel all the way down to Pueblo. I don't want to see that. I don't want to see any struggles with our communication systems because that is not the whole purpose of helping the community. That's hurting the community. So we're really looking to make sure that our community is helping as much as possible. So this is like a very rough list. Don't judge my Excel or Google Sheets skills, but some of these, so like AMR Denver just moved off of their radio requirements in their rigs. So that one's one that I'm going to work with quite a bit on. And there's some new services that are just brand new, trying to get their feet under them and figure this whole process out. So I want to be able to provide them guidance of how to be connected to the PSAPs of the location that they're working for. So this agency is an event agency, and so they operate all over the state and throughout other states as well. So working with them to try to figure out the best region for them to be in is going to be key as well. That's one thing that I am concerned about some of these private agencies is moving from area to area. iCare does have the hardware as of right now, but they are unaware of how to program them. And iCare is an ambulance that specializes in organ transplants and flight transfers. So being on the system is not necessary unless the situation occurs where the big one happens. I'm trying to get a rough estimate area. So this is Denver metro area. This is they're based out of Colorado Springs, but they have locations all up and down the Front Range from Fort Collins to Pueblo. These guys are mainly in Colorado Springs, El Paso County area. These guys are in the Denver metro area. And which one is this? They should have access. I didn't get a hold of this group, but they're in the Silverton, San Juan County area. I assume that they have radios, but I wasn't able to get a hold of them. So some of these out of the 18, these are very rough estimate numbers that I put together, just trying to get an idea. So I could be wrong on some of these. I know the Lifeline ambulances that mainly do critical care transport, they don't have, or they have radios, just no access right now. And then Western is based in the metro area as well. Yeah, Matt.
Regarding Silverton, if you have a contact with CSP, they are their 911 PSAP. You could start there, or of course the Silverton Sheriffs.
Okay. Yeah, and I just have yet to get a hold of them to ask them if they have radios.
Sure.
I know that ambulance service does a lot of high rescue and things like that. So I would assume that they have radio contact. But if I didn't get a yes or no in that list, I just assume that they do not. That way I can have a better number to present to you guys.
Sure, and that would be CSP Montrose, Ben Kiddensheet. Is there a new director?
Okay, cool. Awesome. And Pam, I see your comment in the chat, but I'm not 100% sure what that's regarding.
Sorry, I think it was that the ambulance service, it started with an I.
I care.
I care.
Yeah, so they
weren't sure what they had or where, and that's like, well, what's their service area?
So they have one station that's located at Centennial Airport, and then they have another station that is at Colorado Springs Airport. So they're based both in the metro and the El Paso County area.
Okay, thanks.
Well, like Jen said, I really appreciate you guys being here and inviting me to be involved. I know this is not a very friendly rule. I know it's not a very liked rule across the board, regardless of PSAP, CCNC, and our agencies as well. But just so you know, we are working diligently on trying to come up with the best solution that matches everybody's needs and that does not affect the PSAPs, CCNC, or our agencies. So unfortunately, this rule has been pre-written prior to me and is in effect starting July 1st, 2026. If we can make edits or changes to it, I would love to do that. And if you have suggestions, reach out to Jen. She has my email. I'll also drop my contact information into the chat. You can shoot me an email and we can continue this conversation, but I really appreciate your time today.
Thanks a lot for joining us, Joel. And as I said, you're welcome to stay and you're welcome to bounce, whatever you need.
Okay, thank you very much.
Sure. And will you stop sharing so I can share the next? And you're on mute.
How do you stop sharing?
On the bottom, well, did you find your meeting, your Zoom, or is it still lost?
Oh, I got it up here.
Okay.
Does that work?
Yep. you're
Okay,
all set.
perfect. Awesome. Thank you.
Sure. Thanks. All right. How's everybody doing? Do we need a 10-minute break before we jump into standing reports, or are we good to go?
I'm good to go.
We have a vote for good to go. All right. Hearing no opposition, I'm going to dive right into standing reports. Okay. So, as a reminder, we're trying not to read standing reports out, but I will call on the committee chairs so that if you have anything you want to highlight, you can. I'm going to highlight the fact that we have we'll have several stakeholder workshops as a result of the petition for declaratory order or rulemaking by several of the 911 authorities. The decision in that clarified that optional services may be offered and tariffed, and we had the first rulemaking stakeholder meeting earlier this week. It was March 11th, but the next one is March 18th, 11 a.m. to 12:30 p.m. So please join us for that. All are welcome. I also want to highlight that we have a GIS informational series of webinars and events this year. So I'm super excited about this because, as you all know, GIS is the foundation of NextGen 911 call delivery. And I'm excited to be partnering with One Spatial and GeoComm and Datamark. Didn't want to miss all of those up or mix them up. To bring you a series of webinars and events. So we've got one on May 15th, June 10th, June 12th, July 10th, August 14th, August 20th, September 11th, and October 16th. And the events on July 10th and September 11th will be in person or online, so a hybrid. And those will be in conjunction with the task force meeting in Rifle in July and in Colorado Springs in September. So thank you to those agencies for hosting the in-person portion. All of these will be recorded and put onto our YouTube, but I highly recommend you attend as many as possible because between all of them, at the end of the year, we should have a pretty darn good idea of how GIS is going to integrate into NextGen 911 and what you as an individual PSAP or governing authority will need to do in order to be ready for NextGen 911. So I thank you so much to Matt. He's as the GIS committee chair, he was instrumental in help putting that together as well. So please mark your calendars and plan to join. And I will just stop and see if anybody has any questions on anything on my standing report. I'll see if I can get the box off of my screen share here. Matt, go ahead.
Yeah, that's great, Jennifer. I think the one thing I might say is that a lot of these webinars are going to be geared towards everyone, not just folks wearing their GIS hats as their profession. They'll be good for everyone, or most of them, nearly all of them actually, will be good for everyone.
Thanks for that highlight, Matt. Yes, this is designed for everyone in 911 to understand more about GIS. So thank you. All right, moving on. Lumen, do you have a report for us?
I do not. Thank you.
Okay, any questions for Tressa? And by the way, for those of you who missed the January meeting, Tressa is going to be transitioning into Tim Kunkelman's role. So welcome, Tressa, to the group. And does anybody have any questions for Tressa?
Welcome.
Thank you.
All right, Intrado, BESP report.
Nothing for today, Jennifer. Thank you.
Thanks, Ryan. Any questions for Intrado? Okay, any questions for Bylaws Committee, Kimberly Colton?
Yeah, I have no updates. Bylaws Committee hasn't had a need to meet.
Thanks, Kimberly. Any questions for Jackie Louise for the Legislative Committee? I know we've got a lot going on. That's a short update for a lot of stuff.
I tried to condense it.
It's good.
The only thing I'd like to say today is I just sent another email with a draft white paper to really need on the committee. If you'd like to join the committee, there's on the task force website, you could join the committee and get all our information. And let me know if you have any questions at all.
Thanks, Jackie. Any questions? All right. I know that the 988 report is blank, but we do have Norman here. And so Norman, would you like to introduce yourself and provide any update for 988?
Sure. Thanks, Jennifer. Hi, everyone. I'm Norman Kidachai. I'm a project director with the Colorado BHA. This is actually my first meeting, so I apologize in advance. I appreciate the opportunity to observe and learn how or more on what this task force is about and how we can better support this group moving forward. Kelly Bowman, our former program manager, she typically provided 988 updates, but has since moved to Vibrant, which is the National 988 Network. As a reminder, I just want to let you all know that 988 Colorado is the state's crisis and suicide prevention lifeline, which offers 24/7 free and confidential support for mental health and substance use crisis. Trained crisis specialists provide emotional support, intervention, interventions and referrals to include mobile crisis dispatches. For our 988 and 911 interoperability, the BHA is hiring a 911 and 988 coordinator to develop call transfer protocols, strengthen relationships with PSAPs, and improve coordination for mental health crises that involve law enforcement. We received about 42 applications with 28 meeting the minimum qualifications, and we will be including Jennifer Kirkland and Daryl Branson in the interview process to assist with selecting the best candidate to help push these efforts forward. Currently, we have 83 PSAPs in total in Colorado. Correct me if I'm wrong, Jennifer, but we have 11 active with our current contract center vendor, which is Solari, and we hope to increase that through our relationship building and the recruitment of this position. A geo-routing update, 98 calls were previously routed by area code, sometimes directing callers to national centers outside of Colorado, but as of March 4th, AT&T joined Verizon and T-Mobile in going live. This ensures that all calls are now directed based on real-time location and not by area code, which will essentially improve response times and access to resources within Colorado. Again, we usually just hop in these meetings to provide major updates, but with the recruitment of this 911 coordinator, we hope to attend these meetings more frequently and to provide more 988 updates as we move forward. I'll also include my name and my email on the chat if any of the other regions or any of you have any questions regarding 988.
Awesome, Norman, thank you. Does anybody have any questions for Norman?
Like Carl?
Yeah, I saw today that the Colorado Sun reported like 500 behavioral health specialists have been laid off in the last 3 months. Has 988 been able to hire those people, or have they lost people or anything along those lines?
Currently, we have not been affected. Knock on wood, we haven't been affected at all just yet. However, we do have the enterprise board as well as the BHA that's looking into the protection of our staff members and ensuring that there is a contingency plan moving forward if in the event we do have to lay off any of at least our 988 team. I cannot speak on the other programs of the BHA, but with respect to our team, we remain status quo.
Thank you.
Thank you. Any other questions? I'll take that as a no. Passing it back to you, Jen. Thank you.
Thanks a lot for joining us, Norman. All right. Equal Access Committee, Holly.
Hi, here for questions, but nothing additional.
All right, thanks, Holly. Obviously, Tina is not with us. We do have several investigations under review right now. So I think Daryl is on, and if anybody has any questions, I'm sure he'll be happy to field questions.
I am, and because it's not in the standing report document, I'll just say that we currently have 6 active investigations. I closed one just this morning in which both CenturyLink and the PSAP that was affected agreed that the incident was actually a call handling equipment issue. So it did not meet the definition of a PSAP service disruption. That was one in Sedgwick County. And going forward, the investigations will probably stay open longer than they have in the past, which may be hard to believe because some of them stayed open for a very long time, because I will be waiting to ensure that billing credits have been provided if billing credits were due. So I've been checking up on several incidents from the end of 2024 to make sure that billing credits are being issued. CenturyLink has informed me that that is a manual billing adjustment that they have to do, and so it has taken them some time to get the process figured out. But that at least billing credits for at least one of them have been issued and should show up on the billing for the agencies at the end of this month. So I'll be following up on that. And I'm happy to answer any questions anybody has. Thank you.
Thanks, Daryl. All right. I don't see Kristen on the call. Kristen, are you with us to be able to answer questions on the broadband program? Okay. Jackie Louise, any other additions for prepaid and collections, or does anybody have any questions for Jackie?
No updates this time. Thank you.
All right. Thank you. Kathy had to jump off the call and she will be back later. So if you have questions on EZNet Users Group report, we can circle back around. And she provided the report for the February meeting, but not yesterday's meeting. Yesterday's meeting is up on YouTube if you want to go back and watch it if you missed it. Matt, GIS Committee. Any questions for Matt or any highlights that you want to call out, Matt? Well, he was on.
No, I think there's nothing extra to add to that, what's written. Thanks.
No problem. Any questions for Matt? All right. I see I have broadband on here twice, so I'll fix that for next month's standing report. Deanie, do you have any additions or does anybody have any questions for Deanie for PSCS?
I have nothing further.
Any questions for Deanie? All right. Amanda, I think I saw you on the call. Do you have any highlights for your SWIC update and any questions for Amanda?
This is Amanda. The only highlights I have is we're doing a PACE webinar. I sent out a flyer yesterday. The PACE webinars are in April and radio user training over the summer. I will put both flyers, links to the flyers in the chat for everyone.
Awesome. Thanks. Any questions for Amanda? I'm going to make a shameless plug for those PACE webinars. I know a lot of you are involved in continuity of operations planning for your PSAPs, and the PACE webinars are extremely beneficial for that. So sign up if you can. Connie, Division of Fire Prevention and Control. Anything to add or any questions for Connie?
This is Connie, and I have nothing to add.
Any questions for Connie on either Division of Fire Prevention and Control or Colorado 911 Resource Center? Connie, do you want to talk about the job fair real quick? I'm totally going to put you on the spot.
Well, what I can say is that we've had interest. People have been emailing saying they would like to participate, and I've been saving all those eager participants as we get closer to planning this and getting it set up. And I thank everybody's participation and interest in it.
Thanks, Connie. So I love that Connie's working on this job fair. This idea came to us from Washington State, who's also doing this, and they set up a series of virtual job fairs to bring 911 centers who are hiring together with prospective candidates. So it's kind of a chance for those candidates to ask questions about the job and for 911 centers to highlight what's great about their jobs. It's for anybody in Colorado who wants to participate. And if you do not want to participate live in the webinar, you can still help by sharing that flyer through your social media and any other channels that you use for hiring so that we can spread the news to prospective candidates. We'll also be sharing the list of hiring agencies in Colorado with those candidates. So this is a really low cost and easy lift for you to try and reach out to job candidates. So thank you so much to Connie for working on this and for hosting it. All right, Karen, are you still with us? Do you have anything to add for Rapid SOS and any questions for Karen?
I am still here. I did add the link to a recent podcast with Avive since they were on today, if anybody wants to listen to it and learn a little bit more. And then again, all the free stuff. There's a Rapid SOS community now. We're bringing people together to connect, network. There's hubs for people. You can meet folks from across the country, your level, other levels. There's an ENP support channel. Jennifer, this is a way for folks that are in the Colorado study group to also do some follow-up and studying together with other folks. So helping to support ENPs in that community. Would love to see folks there.
Awesome. Thanks, Karen. Any questions for Karen? All right. I didn't see CJ on the meeting, but I can answer any questions that you guys might have for the Colorado Training Standards Institute update. Our hope is to bring a draft of the minimum training standards that the group has come up with to the Managers Directors Forum at the Colorado NENA APCO conference coming up first week of May, to solicit input and feedback there, as well as share it out with agencies that haven't been able to make the meetings after that Managers Directors Forum. So anybody have any questions for Colorado Training Standards Institute? All right, Kimberly, CCOA.
Hi, everyone. I am on and I'm here to answer any questions if you have any questions regarding the CCOA.
All right, thanks, Kimberly. And that is the end of standing reports. So we will move on to old business. New PSAP discussion is carried on from the January meeting, and Daryl is here. I know Daryl was going to possibly talk about this in the rulemaking workshops, but in the first rulemaking workshop, we narrowed the focus. So Daryl, I didn't know if you wanted to share anything else here on the discussion for new PSAP creations.
Yeah, since rulemakings take so long to do and we're getting ready to do one, I had suggested at our first rulemaking workshop that maybe we could address this at the same time. However, there is an urgency to that rulemaking for basic emergency service optional services and how they're going to be reimbursed through the 911 surcharge. So it was the consensus of the group that we will not be adding additional changes to the rules in that rulemaking. However, if anybody has any questions or thoughts about this document that outlines our thoughts on how we could address the creation of new PSAPs in the Commission's rules, the thing I was trying to address in here was the concern from task force members that entities that shouldn't be setting up new PSAPs could essentially just do that by purchasing off of the tariff as it is now without any additional oversight. However, our rules do already contain a section that requires entities, including government entities, or specifically government entities, to obtain permission from the Commission before using any of the abbreviated dialing codes, which includes 911. So what I was going to do was to suggest that we create some rules that help shore that up and make it clear that the BESP should not sell services, basic emergency services, to entities that have not obtained permission from the Commission through a petition process. I do want to make clear that the Commission is not expanding its authority in this way. We still do not regulate governing bodies or PSAPs. However, because we do regulate the entity, the basic emergency service provider that sells that service, we can state who that entity is able to sell the service to or not. So that's the statutory authority that the Commission has to do this. And we do have precedent in the past with the offering of 311 services, where we do require government entities to file a petition with the commission for permission to be sold 311 services from the telecommunications carriers. So if anybody has any questions or thoughts regarding this document, as I said, this will take a rulemaking, so we will not be moving forward with this until we have time to do another rulemaking. It'll be after the current one. So this is not an urgent matter at this time, but I do know that it was a concern of members of the task force.
Thanks, Daryl. And I know we had desire expressed at the last meeting to continue the discussion. So I will open the floor to anybody who has thoughts or comments or wants to continue that discussion here.
And I'll just say, if there's no discussion today, what we could do is wait until after this current rulemaking or the upcoming rulemaking is complete, because we don't want to do two rulemakings at a time. I don't think anybody has the bandwidth for that. And then maybe bring this issue back to the task force and see if it's still a concern. And if there are any other thoughts at that time. That will give people lots of time to think about this and and decide if this is the direction you want to go to address your concerns.
Thanks, Daryl. This document that I'm showing is in the meeting materials for today's meeting, accessible on the task force website, so you can peruse it at your leisure. And do we want this to be on the agenda for the May meeting, or do we want to table this until after the current rulemaking? Well, the upcoming current rulemaking.
Well, since nobody else is speaking up, Jennifer, I'm going to suggest that it get tabled until after the upcoming rulemaking.
Any objections to that? Okay, that's what we'll do. Thank you, Daryl. Okay, so the next item on the agenda was additional services on the tariff, and this was going to be a continued discussion from the January meeting. Tina is not on the meeting. Does anybody else want to pick this up and continue that discussion, or do we want to table it until the May meeting?
I would say we table it.
Thanks, Kathy. Anybody else? So there's been a lot of movement on the topic outside of the task force since we had this conversation in January. CenturyLink did pull the proposed tariff amendment with those new services, and we are again conducting pre-rulemaking workshops on the funding of those optional tariff services. So I know the conversation is continuing in other forums, and we encourage all of you to participate in those workshops. But I'm also happy to continue the discussion here if the group would like. Okay. Hearing none, then I'm going to move on to the next item, which is discussion on anything this group would like to request from the Technical Assistance Program. I'm going to stop sharing for a minute because I forgot to pull up the documentation out of the drive that I wanted to share with this. But while I do that, I know that Amanda is still here. Thank you, Amanda. And I know that they have paused new technical assistance requests until further notice, which is totally fine. But I want to make sure that we are ready to make a request when it becomes time or when those technical assistants become available again. And so, hold on just a second, let me move this over so I can share it. I wanted to see if there was anybody else had any ideas or thoughts about what we would like to request as far as technical assistance as a state out of the presentation that Amanda and Jeremy made at the January meeting. Okay, well, hearing none, I had some thoughts and I want to propose to the group. This is out of the technical assistance catalog that Amanda shared, and these are the offerings that they have available. So specifically looking at the one-day cyber threat awareness workshop or the public safety answering point cyber awareness overview. We are doing, as you know, the series of GIS awareness and in-depth trainings. But I also think that the state would benefit from some specific cyber awareness or cybersecurity conversations. And so I wanted to propose that when the opportunity becomes available again, that the task force and Colorado look at requesting either the one-day cyber threat awareness workshop or the 911 and public safety answering point cyber awareness overview. And I wanted to see what everybody thought about those particular topics or the need for those.
Jennifer, it's Pam.
Hi, Pam.
Could I toss something in here just as a sidebar that at the Public Safety Summit in the first part of May, we have a couple different cybersecurity presentations, both physical and network, during the summit. If anybody that's on this meeting is interested, certainly the summit is free. It's May the 7th and the 8th, and you're more than welcome to attend those and then go ahead and submit your request for the TAs. We just have no idea what might be delivered or when it might be delivered. So just as an alternative if we can't get those TAs for you, just a bit of information.
That's perfect. Thank you, Pam. Okay, well, I know that we're hopeful that the TA program will continue to go forward, and we appreciate Amanda's work as our SWIC. So thank you, Amanda, for that. It takes a little while for those TAs to be approved once they're requested. That's just the process. And so I would encourage the task force to be thinking about if they would like to request any TAs once the request period becomes open, to be ready with what we want to request so that we can coordinate it on a statewide basis and make it fruitful for all. I also want to call out there are several cybersecurity resources on the 911 program website and links to CISA, which has a new toolkit as well. Cybersecurity, I know a lot of us in the 911 space like to think, oh, that's IT's job, but there's a lot more that goes into it. And I would just encourage everybody to take a look at those resources. Anything else on that? Okay. Well, moving on to new business, we already heard from Joel. Thanks again for Joel joining us. So the next thing we have on here is vacant positions. We have an ILEC position voting member on the task force that's open. I'm going to pull up my email, and because Tina had found someone who was willing to serve, as the ILEC representative for that open position. So give me a second while I just pull up that email real quick. Tina let me know that she was going to be missing today's meeting kind of last minute. So hopefully everything is okay for her. And let's see. Here we go. Okay. So Jason Hendricks from Range is willing to serve on the board in the vacant ILEC position. Is Jason with us today? Well, I don't see him on the meeting, and I don't see, I think what we'll do is just table this until the next meeting so that Tina can make a motion and maybe Jason can be here to accept that. So we'll move on and table that. All right, so I already talked about the GIS informational series, but again, please mark your calendars and plan on attending. So the final piece of new business is the May meeting. So as Pam teed it up for me, thank you, Pam. The Radio Summit is May 7th and 8th this year. It's being hosted in Douglas County, and it is chock full of great presentations, but it does conflict with our May 8th task force meeting. So I wanted to ask the task force if there are enough people who are going to the Radio Summit, do we need to reschedule the task force meeting, or do we want to keep the task force meeting on May 8th? And along with that, we have an in-person component to our May task force meeting. We are going to be in person at JeffCom, at the new JeffCom. Can't wait to see it. And so I'm glad we've got Jeff here to just make sure that if we do decide to move it, that they can accommodate the new proposed date. So what is the task force preference? Keep it on May 8th or move it to a different date to so as not to conflict with the Radio Summit? Tyler says it is the same week as Colorado NENA APCO. That is the week of the conference. The conference itself is Monday through Wednesday. So the task force meeting isn't a direct conflict, but it is right after. So that's a good point, Tyler. Thank you for bringing that up. So what is the task force preference? Keep it or move it?
I mean, my vote would be to keep it, but I think there's been a conflict over the several years with the Radio Summit, same time as APCO NENA, as well as the task force meeting.
That is true.
Jennifer, can you maybe do a show of hands of how many people would be attending the Radio Summit and have a conflict? Because if there aren't really many people attending, then I don't think we need to move it.
The difference is this year they're going to allow virtual attendance, so there may be more people wanting to attend.
I'm happy to do a show of hands. I'm also happy to just have a conversation. So do we have a show of hands of who's planning on attending the Radio Summit? When I went to look at show of hands on a different Zoom, I couldn't even find those reactions, but we do have a thumbs up on the reactions down at the bottom or a raise hand feature.
My priority would be to attend this meeting rather than the summit if there's conflict.
It looks like there's not going to be a ton of conflict, at least from the people on this meeting right now. So at this point, it looks like there's reason to just keep the date. Daryl, go ahead.
Tyler Gross in the chat says that it's the same week as NENA APCO as well. Is that right?
It is, but the conference is over on Wednesday.
Oh, okay.
Yeah.
So there shouldn't be an overlap.
No. Okay. Go ahead, Jeff.
I move that we keep the date.
Sounds like that is the consensus. All right. Well, then we will keep the date and we will be in person at JeffCom at their new building. So congratulations. And we will also be online for those who can't make it in person. So thank you to Jeff Com for hosting. We also have our next meeting. We have a June Lunch and Learn with GeoCom. That will be one of the GIS series as well. So before we adjourn, I will just ask if anybody has anything for good of the order. Jeff.
I was wondering if you wanted to go over the list that I had sent you and Kathy yesterday in regards to the implementation.
Sure, I'm happy to share. Let me get it out
Okay.
of my email and set it up. Hold on just one second.
Okay. I thought since we're running quick on this, it would be an opportunity to at least address it or bring it up initially.
Yeah, no problem. 1 second.
Didn't mean to put you on the spot, sorry.
Okay, I got it. It's just a question of which screen is being shared at any given moment here. Okay. Go ahead, Jeff.
All right, thank you. So we spent some time, when I say we, it was Kevin Newton and I and Tracy Dello worked through the sites that are going to be getting the new SANet connections. The first thing I want to note on this is that we did spend a lot of time, but during this process for the project itself, there should be, and I use the term should strongly, be no interruption of your current service. This first stage of this list that we see here is going to be bringing the actual circuits in, and the only interruption would be actually getting access into the site itself. And our intent on this is not to say this is the list. Our intent is to say this is what we're proposing. Are there any issues or challenges with this? And the main reason for the date on the right, in the far right column, is to be determined, is because we won't know those dates until we actually start to get the orders put into the system, which is going to be happening, I believe, next week. So this is the first rough draft. And Jennifer, I don't know how you want to handle this as far as either putting this on the website to see if people have an issue with the group that they're in, or how we want to go about that. But at least we wanted to present the first step of this. And there was some method to this as far as how they're going to be implemented due to some of the builds that we're going to potentially see. It's going to take a little bit longer time. That's why we're starting them that way. But I'll open it up for discussion, or if anybody wants to see it, or however you want to handle this.
Okay, so Kyle had his hand up, but I wasn't sure if that was a question for this or something else to add for good of the order. Kyle?
Just come back to me when it's my turn for good of the order. I'm good on this.
Sounds great. Joe?
So what are the impacts on the PSAPs going to be? I mean, for example, the Boulder PSAPs would be concerned with not having impacts during move-in for students at CU, but I don't know that what are the impacts that in fact the PSAP would see?
Sure, I think the only impact that we'll see potentially is if there's going to be a build, whatever will be involved with that. Other than that, it's going to be getting access into the PSAP itself, where the circuits need to terminate to be able to do the initial testing. And then secondly, when we get to the point where we're going to move everything over to the Ethernet, the only other impact would be moving one circuit off, and that's going to be coordinated effort with Intrado, and bringing up the new circuit and then doing the other one after everything has been tested on it. So there really shouldn't be an impact of service or disruption of service at all.
Well, you're talking about moving the circuits over. That's going to be physical. That's not going to be a programming change at a knock or something.
Right. And I'll have to double check with this with Intrado also, but my understanding is that all the programming and everything else will be done in advance. So it's just going to be almost like what's referred to a lot of times as lift and lay. So they take one circuit out and put the other one in.
What time of day will you be doing these changes? Will these all be done at like 2 a.m.?
That has to be determined, and we will work with the PSAPs as we go through that. If there are concerns with that, by all means, yes, we could work with whatever scheduling is needed.
And what is the risk of outage?
Right there, right now, from what I understand, what I've been told, it's minimal. I can't say there's no way that you won't have an outage, but with the work that needs to be done, it's going to be minimal.
Yeah, I mean, I think we had an outage when somebody removed at a switching center or something, the wrong piece of equipment and took everybody down. And
oh, by all means, yeah,
anyway, so that we have to accommodate, the possibility of human error.
Exactly. No, that's always a factor, but for the work that needs to be done with this specifically, we shouldn't see an outage at all.
So Jeff, if a PSAP is not on this list, what does that mean?
That they do not have a current connection coming in for them. There are going to be some scenarios in the case like with LEDA, since they have a geodiverse solution, not all of their locations have Ethernet or have existing Ethernet connections.
And I know that in the improvement plan process, it was reported that some PSAPs already had last mile diversity. So is that obviously those are not going to be on here either?
Well, they should be on there because it's not what we're doing is not necessarily last mile diversity. We're changing the technology from current DS1s
I was
to
confusing the
IPv4.
projects.
Yeah.
Sorry.
Okay.
This is the Ethernet change.
Correct. Yeah, I titled this incorrectly. It shouldn't say Ethernet improvement. It should be Ethernet.
Thank you. I had it wrong in my head. I thought this was the last mile diversity. So this is the Ethernet upgrade.
Correct.
Got it. Thank you. I think the easiest way to get this out is to have Kathy email this out to the EZNet users group. I don't necessarily want to put it out on a public forum.
Okay.
But who else has questions for Jeff?
Again, I just want to make sure that people understand we're not saying this is what we're doing. We want to work with you as much as possible to make sure that if there's a major concern, if there's a festival or something going on that could potentially impact access to the PSAP, then by all means, we can start to move things around. I don't know, we've already had some requests as far as being at the bottom of the list, and those have been accommodated also.
Sounds great. Any other questions or thoughts or comments for Jeff?
Thanks, Jennifer.
Absolutely. Tim, did you have something to add?
Yeah, just real quick on the scheduling. What like Jeff said, we want to accommodate folks' schedules. We just want to make sure that everybody's aware that there is a 2-year time limit on getting this done, per the rules and per the improvement plan process. So while we want to accommodate folks, there is going to be a point where we may not be able to keep pushing you later and later and later just because of a deadline we must meet.
Perfect. Anybody else?
Jennifer, I had a question on that list. I'm just wondering if the PSAPs in one authority are spread out in different phases, if that's going to have any impact, or it's where they all need to be all in the same phase under the same authority.
I can talk to that a little bit. When we went through that, we tried to keep those in the same group as much as possible if they were in the same authority. So that is something we did look at. But if there's still a concern with that, definitely bring it up and we could address that, see what we can do to accommodate it. It shouldn't have an impact. If we have PSAPs that are in the same authority and they're in 2 different groups, we shouldn't see an issue with it. But again, if it is a concern, let us know and we'll work with you.
Okay, because I did see real quickly, I think some of the groups in Bretza were split out.
Okay.
Anything else? Matt.
Amber's not here. She's in another meeting. But I think that for Wesco's sake, we'll be fine with a reasonable amount of advance notice for scheduling or discussion and try to be accommodating. Just nothing last minute. Or not even a tech walking in and saying, "Here I am," which has happened to all of us at one point or another.
But by all means, Matt, when we get the dates on this, that'll be the first communication to go out as far as the dates that we're looking to do. We'll still have some ability to move those around if needed and work with you 100% on this.
Right on.
Thanks, Matt. Anybody else? Okay, thank you, Jeff, for bringing that up. Kyle, what you got?
So just for the May meeting, I'm going to be working with Jennifer directly to send out something ahead of that. Just for awareness, our parking situation at JeffCom is going to be a touch tricky that day. We do have some arrangements with some of our neighbors to make arrangements if we have people coming in. I just need to be able to give them advance notice of that. So we're probably going to send out an RSVP. So if you are going to attend in person, just please reply to that so I can plan accordingly. But all of that will be sent out ahead of time. Just wanted to let everybody know.
Perfect. And I'll usually send out a RSVP anyway to get a head count for lunch. So we'll just include all of that together.
Okay, perfect.
And Kyle, if you want to put together in kind of a diagram showing people where to park, we can send that out too.
Yeah, we have one. I'll have to modify it for these purposes, but yeah, we'll be able to accommodate. It's just going to be kind of nuts. That's all.
Sounds great. Thank you. And thanks for hosting.
My pleasure.
Carl.
Yeah, this question's for Kyle. Are you guys right next to the courtyard that's on Indiana?
We are indeed. We are indeed. You can spit from one and hit the other.
Okay, thanks.
You bet.
Let's not actually spit though. All right. Anybody else? Well, I do want to highlight we have an April Lunch and Learn on April 10th at noon. Jeannie Palmer from the Colorado Burglar and Fire Alarm Association will be talking about alarm verification and scoring, which is something that will affect all of your PSAPs. So please join us. Join us for the May task force meeting and, of course, the Lunch and Learn coming up in June for the GIS series. So anybody else for good of the order? Speak now or forever hold your peace. All right, thanks everybody. We'll adjourn at 12:03 and I hope you have a great rest of your week and a great weekend.
Take care,
Thanks,
everyone.
Jennifer.
Thank you. Thank you.
Jennifer, I'll give you a call in a little bit.
Okay, sounds great.
Thanks.
Thanks.